Hi there, everyone, and welcome to today's webinar from the TUC. I'm Anna, and I'm delighted today to be joined by two guests. We've got Zenei Cortez from the National Nurses Union in the US, and Mariela Kohon, from my colleague from the TUC, who's a Senior International Officer. I'll be getting them to introduce themselves shortly. Just a little bit of housekeeping before we get going properly. I'm sure many of you have been on our webinars before, but just a reminder, or for any new viewers, we've got a chat panel on the right-hand side. It's great to see some of you already using that to exchange some tips and ideas and tell us a little bit about yourself. My colleague Alice will be there posting any links to any resources that we might talk about. There's also an Ask a Question button underneath us here. If you've got any questions for our speakers, please post them there, and we'll try and get to some of them after we've heard from our speakers. There are also live captions available, so please click the green button underneath the screen that says Watch with Live Transcript. That will open a new window where you'll be able to see live captions. But if you do that, please remember to close this original window, because otherwise you'll get an echo. If you have an echo, it might mean because the webinar is running in two different windows. We are recording this session today, and we'll be making it available on our YouTube channel probably tomorrow, and we'll send a link to anyone who's registered. So without further ado, I'm just going to get our speakers to introduce themselves, and just bear in mind that, you know, we've all spent the past 4 months living a very different life to the one we did before. COVID-19 has changed our lives, but it's not just here in the UK, it's changed the whole world. So that's why we're having a webinar about international solidarity and what we can learn from COVID-19. So first of all, Zenei Cortez, can you just introduce yourselves, please, for our audience, and tell us a little bit about yourself? Zenei, do you have the webinar open in two windows? Perhaps did you click the green button at the bottom? Have you got more than one window open?
Except this one.
There's a real echo. I mean, it was fine a minute ago. How have you got multiple tabs open on your browser?
I'm good. Can you hear me?
There's some real, we can hear you, but there's a real static that I think is coming from another browser tab. Have you got any headphones at all? I assure you, before we went live, it was fine. This always happens, but we'll get there. As soon as I see the earphones go in, I'll see what we can do with unmuting. Right. I'll tell you what, while we're trying to work out what this issue is, how's that actually? Is that better?
How's that?
Okay, I'll tell you what, Mariela, why don't you introduce yourself while we're trying to sort this out, and just tell us a little bit about who you are, and maybe some union wins you can tell us about, and I will message Zenei separately.
Okay. So, hi everyone. Thanks a lot to Anna and to Alice for organising this and for the invitation. I'm Mariela Kohon. I'm the Senior International Officer at the TUC. We have a team of people that work on different aspects of our international work, and trying to build our relationships with unions around the world, sharing good practice, campaigning and lobbying on different areas that affect workers' rights around the world, like trade agreements, international development, supply chains, and also building international solidarity.
Great. Yeah. While I'm trying to diagnose what we can do, can you perhaps tell us about some of the other union campaigns that have been successful over COVID-19 and what we perhaps can learn from them?
Sure. So one of the key lessons I think we've learned through this crisis really has been the importance of sharing experiences internationally. And we've seen the international trade union movement put a lot of time into collating experiences from different unions, different sectors around the world, and sharing those practices. Another thing that we've seen throughout the crisis, and we've talked to a lot of trade union colleagues around the world, is really that those pre-existing structural inequalities have been exacerbated by the pandemic, leaving many workers unprotected, disproportionately hitting Black communities, Indigenous communities, and also women and migrant workers have felt a disproportionate impact of the crisis. And one standout thing on the positive side is really the crucial role that social dialogue has played in finding ways forward, and the fact that governments and employers have had to engage with unions where they might not normally, or have increased dialogue where they do have some dialogue. And we've seen that this dialogue has resulted in better economic packages and better protections for workers. Obviously, the role of the extent of influence of unions depends varying on country, on the sectors, and there's been some countries where we've seen the opposite, where the government's authoritarian regimes have taken advantage of the crisis to really crack down on rights. But some examples, I think, on the positive side that we've looked at with interest and closer to home really have been ones like Spain, a country that, as you all know, has been hit very hard by COVID. But we have their progressive government and a constant social dialogue, constant engagement with the unions since the beginning of the crisis. Right at the start, when the crisis hit, the government there established what they called a general bureau for the management of the pandemic. The bureau is made up of 5 key ministries: economy, finance, labour, social security and just transition, and has trade unions and employers take part. There's also a specific roundtable convened by the Ministry of Labour that has the involvement of unions and employers, where they've negotiated the equivalent of our job retention scheme. In Spain, last month, the government also introduced a minimum income, a benefit for those people deemed most vulnerable, and the government is going to pay a monthly amount and top up existing revenues for people that are earning less than that minimum income. And this is something unions have been campaigning on, before the crisis for 4 years. So it's been hugely welcomed and highlighted by several unions around the world. They've also reached sector agreements in many areas, and for return to work, where Spain's slightly ahead of us in terms of opening up and going back to work in sectors that hadn't been at work, they've agreed several measures by sector. So in the perfume and cosmetics industry, on construction sites, the metal sector, food and beverage, the car industry, and also public sector workers. One of the key components of these is that unions are involved in monitoring the implementation of these. Italy, another country that we know has been hit, extremely hard by COVID. We've also seen action by unions, to effect change. In March, the Italian government had introduced a list of what they deemed to be essential economic activities that needed to be open under the crisis. And actually, the 3 trade union confederations threatened a general strike. Obviously, different situations to here. And as a result of that threat, several industries were shut down. And the list was reduced. So the car industry, clothing, rubber, agricultural, machinery, and some areas of the chemical and plastics industry. Also in Italy, in terms of returning to work, they are ahead of us, and by some weeks in terms of lifting some of the measures. And they've also had a health and safety protocol agreed with employers and endorsed by the government for a safe return to work. And then at company level, additional protocols have been negotiated. One example is in Fiat, where an agreement to adapt the shop floor, the factory layout, has been reached. The measures include cleaning of the premises, taking workers' temperatures regularly, providing safety devices such as masks and hand gel, rearranging the assembly layout, marking floors to ensure social distancing, staggering shifts, and rotating furlough scheme. And there's been other protocols reached in Italy in the construction sector, in the transport sector, for example, trains now, the high-speed trains that go between big cities are only operating at using one seat for every 4 passenger seats. They've then topped that up by using buses that aren't being used for school because schools are closed until September. And the other key thing in Italy, like Spain, is that there's monitoring committees with union involvement for all these measures to oversee them. Other countries where we've seen some interesting developments is Germany, which obviously has a huge culture of social partnership. But the Metal Workers Union there negotiated a package which, along with guaranteeing 80% of the salary for short-time workers, it also included a childcare package where 8 days of childcare were given due to the closure of schools and kindergarten for parents with children up to the age of 12. In Ireland, employers and government and workers have agreed a safety return to work protocol, and the parties have agreed that every single workplace across the economy will have at least one worker representative appointed along with management who has to oversee the implementation of these protocols. In the education sector, there's been some interesting agreements. In Argentina, the teachers' union signed a collective agreement with the government to try and tackle the excess workload that's been faced by teachers having to work online. The agreement sets out the concept of the right to disconnect as a fundamental right of teachers, and it provides for specific times to rest and respect of privacy of education workers. And it also requires the Ministry of Education to invest in providing technology for teachers. In Uruguay, where schools are partially reopening, we've seen an agreement which has schools open for just 3 hours a day, 4 days a week. Attendance is voluntary, and there's a whole package of measures that the Ministry of Education has brought in to protect workers and students. So there's testing of all education staff in areas where there's been the virus, there's a flu vaccination, there's special protocols for young children and for elderly teachers. So there's some of the measures that we've looked at. Obviously, there's many more, and if people are interested in specific sectors or specific countries, we can also send and facilitate some of those links. I think one thing we've also seen is industrial action and legal action being taken by unions where they haven't been able to negotiate with the company. One company that stands out for bad practice is Amazon, where across the world, in France, Italy, and the US, workers have seen themselves not being respected in terms of health and safety measures. In France, workers took Amazon to court, and actually a court rejected Amazon's appeal against a ruling and restricted what Amazon can deliver during the crisis. In the US, just a few days ago, warehouse workers won a lawsuit against Amazon because Amazon was penalizing workers for taking the time to wash their hands and disinfect stations. So they've now had to announce that they won't be penalizing workers for taking those essential measures. And it's not been all good news. Obviously, we've also seen the huge impact of the crisis on the informal economy, on the most unprotected workers, and in countries which were already facing difficult situations. The International Trade Union Confederation has done a study and highlighted some cases where, for example, in India, we've seen that they've tried to crack down by increasing work hours from 8 to 12-hour days, where the impact on the informal economy workers have been huge, where migrant workers have been stranded in unsafe conditions. And we've seen authoritarian and far-right regimes really take advantage of the crisis to further abuse workers' rights and human rights. So in Hungary, a state of emergency was brought in, which tried to change, Labour rights. In Romania, the right of strike has been restricted under another state of emergency type legislation. In Turkey, curfews were installed and union leaders have been arrested for assembling and carrying out, for example, symbolic May Day events. Also, the right to strike, union rights has been affected in Turkey. We've seen the devastating impact of the far-right president of Brazil, Bolsonaro's completely unhinged response to the crisis and what that's meant for indigenous communities, for workers. So really, for us, what we're seeing is that if we want, workers' rights to be improved across the world, we need stronger global rules. We need improved structures, and we have to target some of that structural inequality that unions have been campaigning on for years. So the international trade union movement has made several demands internationally that the TUC has supported around establishing a global fund for universal social protection to support the poorest nations to respond to the pandemic with healthcare and income support, calling for a new social contract that guarantees workers' rights, a living wage, health and safety. The TUC has also set up a website page specifically dedicated to looking at gender-based violence in the context of COVID, and campaigning for countries to ratify the ILO Convention on Violence and Harassment in the Workplace, and also linking it to the climate crisis and the need for a just transition, any measures in terms of recovery to be linked to a proper just transition, protecting workers and making steps towards environmental sustainability. So I think, just to end, really, the crisis has shown, that we are all connected, that this is a truly global crisis, and we need a truly global response, and that unions have a key role to play in defining that response and putting forward our vision in tackling that structural inequality, structural racism and gender inequality that's just been exposed even more through this crisis. I think the global sector union federations have great resources. I know Alice has put up one from Education International, but if there's any information that we can help facilitate or provide, we'd be very happy to. And thanks for the opportunity. And it's great to share the platform with Zeni. I hope your sound is now being sorted.
Thanks, Mariela. Okay, I'm going to give it another try with Zenei. Let's hopefully you'll have received a message from your colleague Gerard about turning your speakers off. Let's give it a go. So how's this?
Hi, how are you?
I've never been so relieved. Hi. Whoa,
Okay.
I've never been so relieved. Fabulous. So can you introduce yourself and tell us a little bit about what you've been doing in the National Nurses Union in the US and the work you've been doing throughout the COVID-19?
Okay.
It's great to have you.
First of all, I apologize for all the technical difficulties. I'm not a techie person. I'm a bedside nurse. So anyway, my name is Zenei Cortez, and I'm a bedside nurse, and I have been a nurse for 4 decades. And thank you for inviting me on behalf of our union. And I'm so happy to participate in this webinar. And I look forward to sharing with you our experiences around organizing and also hearing from others about their experiences and victories. So I'm president of the California Nurses Association and also of National Nurses United. National Nurses United is largest and the professional organization of bedside nurses in the USA. We are also part of the Global Nurses United, an organization of 28 countries, nursing organizations from 28 countries all over the world. So what are we doing as far as organizing in general? Organizing in the healthcare sector in America is very challenging because it is an industry. We do not negotiate with the government like most countries do, but we negotiate with individual employers. And that's very challenging, but as nurses and as our organization love to do, we take up the challenge. So for the last 3 years, National Nurses United has organized more than 6,000 nurses from 15 hospitals across the country. These hospitals are Methodist Hospital of Southern California, Chinese Hospital here in San Francisco, Ingalls Memorial in Harvey, Illinois, Community First Medical Center in Chicago, Illinois, St. Joseph's Medical Center in Tucson, Arizona, St. Mary's Medical Center, again in Tucson, Arizona. And although these hospitals vary in location, size, and demographics, the nurses face a common issue, and that is unsafe staffing. The nurses face a common issue, and also what unites them universally is that hospitals are putting profits over patients. They put profits first over patients. So nurses have had enough. They're tired of being ignored, and they start to organize and network among each other. Then, at a certain point, after having access to a facility, and we estimate that the majority of the nurses want a union, we distribute union authorization cards. As for an example, in Chinese hospital here in San Francisco, we were able to get the majority of the nurses sign authorization cards in 1 week. So that was a great victory for us. But then, we face many challenges as well. And we would like to share some of the practical tips that we have used. What extremely is important is at the beginning of the stages of a campaign, while nurses are still building their network, it should be done under radar, because if the hospital management hears about it, then retaliation and ways and means to squelch that organizing happens. So nurses do need to talk one-on-one with their colleagues, and then talk to them about what issues are important to them. Then that way, when one of our organizers come in to talk to the nurses, then we know what's important to the nurses. And also, we need to make sure that the influencer or the most respected leader in any department or any unit needs to be involved in this organizing campaign, because they will be the ones leading the fight. Also, once hospital management hears about the organizing that's happening, they conduct an anti-union campaign, which means they would hold town hall meetings, they would have captive audience meetings, and also pull the nurses one-on-one to sort of influence them to not have a union in that certain facility. So it would mean nurses are being pulled in so that they can be brainwashed that a union is not good for that facility. And we know right off the bat that this will be happening, so we will warn the nurses that this is about to happen. So they know upfront that this is part of management's ploy to stop the union from coming into a facility. Then once we have a group of nurses, leaders that's ready to do the rest of the collection of cards, we focus on the nurses' issues and what do they want to see improved. Then that way we have a common goal or a common ground as to where we would start talking to the nurses. The nurses want to envision a future where they have a voice and they can advocate for their patients without the fear of retaliation. So for those nurses who have gone through the process, in other facilities, we allow them to come and talk to those nurses who are wanting to join a union. So that way they could share their experiences. And also, we want the nurses to know and realize that it is their right to join a union if they want to, but we have to forewarn them that the employers will do everything they can to stop the union from coming into the hospital. So once we have established a pool of activists and nurses who are supportive of a union, we would do a video and facilitate that video by sharing it to all the other nurses, put it on social media so that the nurses know that they have nurses in that certain facility who are wanting a union to come in. And also, before we do the election, we put out a flyer saying that these are the nurses, these are your nurse leaders who want a union in this facility. And so we call that a Vote Yes flyer. So that has been very helpful in the past. So, what have we won as far as contracts once we have the union established? We provide the nurses with tools to promote safe staffing in the hospital, such as establishing a professional practice committee. And this committee is a committee of staff nurses who are elected by their peers who look at nurse practice issues, they look at unsafe staffing patterns, and then they recommend to management as to how they can move forward in order to improve uh, patient care, patient staffing, safe staffing, and also nurse practice issues that needs to be addressed. And it is a practice committee that is um, recognized by the employer, and they listen to the recommendations of this committee. Another tool that we have put forward is what we call the assignment despite objection form. So in other words, we call it ADO for short. It is a form used by RNs to formally document circumstances in which the nurses are put in a precarious situation, like in unsafe situations wherein they're so short staffed and that they see that the conditions are unsafe. And this document is recognized by management, and so management needs to respond to that particular assignment despite objection form. And management is given 7 days to look at this. But in that moment, management needs to address the issue. So the nurses are not objecting or they're not refusing the assignment, but they're objecting to the fact that the assignment is unsafe. So the onus of the burden of proof is now on management. And also, we have managed to increase pay raises that rewards years of experience, and these helps retain and recruit experienced nurses. And also, we make sure that there is a just cause for grievance provisions for fair discipline. We have improved benefits like increased weekend differentials and shift differentials as well. And a strong union that we have provided them with a strong union that nurses can rely on in difficult times, such as in this situation of the COVID-19 pandemic. And also, our contract provisions are includes workplace promotes safer workplaces and promotes solidarity among nurses and other hospital workers. So what are we doing now as far as organizing in this current climate in our COVID situation? But despite all of this restrictions and challenges imposed by COVID-19 pandemic, we continue to be successful in our organizing around having the optimum personal protective equipment and other protections for ourselves and our patients. As you all might have seen and heard, our for-profit healthcare industry was woefully unprepared for this pandemic. And I am also sure that you have heard that our current federal government is so inept and is so unprepared and frankly dismiss COVID-19 as something that would go away in a few days and something that anybody should not be concerned about. I'm sure that you've heard about it. So, as often is the case, we have to fight hard for our own protections, for our patients and society at large. But that's what nurses do, correct? So, some of the highlights we have established or we have gained during this time is that we have managed to hold actions and lobbying of local politicians and community leaders and subsequent press coverages that have gained some victories. And to name a few, the Community First Medical Center in Chicago did not have full personal protective equipment for the nurses. They were using trash bags to protect themselves. So when we expose that to the media, now the nurses in that hospital has full use of PPE, and they no longer must reuse their N95 masks. Also, in the big hospital chain of Dignity Health, um, when nurses were using their own masks, they were told they could not do that, in spite of the fact that the employer could not provide it for the patients. They were threatened that they would be terminated when they use their own PPE. So we did a pushback, and now nurses are allowed to use their own PPE. Also, another major hospital chain, Kaiser Permanente, did the same thing. They threatened nurses when nurses brought in their own PPE. So now we are allowed to use our own PPE because at the beginning we did have inadequate PPE. Um, Also, we managed to have another hospital, and most hospitals provide scrubs to our nurses so that when they come in, they could come in street clothes, change into scrubs, do patient care, do their shift, and then um, go home in the fresh street clothes that they came in with so that they're not exposing their families and the community when they come home. So overall, we have taken about 400 actions to push back on the lack of PPE, including 160 actions on International Workers' Day alone, all socially isolated and gaining a lot of press. We have applied consistent pressure on regulatory bodies internationally, nationally, statewide, and locally to provide protections to the RNs. We have put together petitions with over 4,000 signatures and letters to all government agencies. We have also developed 3 registered nurses surveys to inform us as to what nurses on the front lines are facing to counteract the myths and, frankly, the lies that are coming from the White House and, nonstop lies and myths and misinformations that are spreading, and that nurses are well protected and nurses are okay, which is far from the truth. Then our research and nursing practice departments have updated us daily on the latest science on the spread of the virus and on what public health measures should be in place as far as protective equipment and COVID-19 protections. And for those of you who would want to access our website, nationalnursesunited.org, we have a lot of information on all of the aspects of COVID-19 so that nurses can be educated across the country, and also the public could access that website as well. Then also we have following the following resources where nurses can be informed and the public can have access as well. We have a COVID-19 Facebook group. We have COVID-19 live webinars. And also we have urgent notifications to employers about unsafe practices. I'm so proud to say we continue to be the only voice and the leading voice in the fight for Medicare for All. It's a system much like what you have in the UK, the NHS. And we see it very important now more than ever, as we need to establish that system. And also for your information, before the summer ends, we will have an estimated 27 million people lose their healthcare insurance due to COVID-19 pandemic, because a lot of our insurance is associated with our employment, and we do have a high unemployment rate right now. And this will be in addition to the 20 million who were uninsured prior to this pandemic. Just think about that. Close to 60 million people without healthcare in this country. So these are just the highlights of our organizing work and some of the work that we do. I'll be happy to answer questions if you have them. And thank you once again for inviting us to be part of this international webinar. And there are 20 million nurses all over the world facing the same challenges that we face here in America. And now more than ever, we need to be united, and we need to learn from each other, and we need to stand in solidarity with workers all over this world. And thank you so much once again.
Thank you so much, Zenei. That was incredibly, I think, inspiring. And I don't know whether you can see the messages that are being posted in the chat at the same time, but there's lots of our viewers who are saying the same as me, that it's really, really interesting to hear you say that, and absolutely solidarity to you and your colleagues. I think one thing we've really noticed in the UK over the past 4 months is an incredible debt of gratitude to anybody who works in healthcare or in the care system, and that's something that's really come out in recent months and weeks. So I think that is something we can extend to you. We are having some questions posted, so yes, viewers, if you do have any questions for Mariela or for Zenei, please post them in the Ask a Question panel, which is underneath us here. I'm going to start with a question that is perhaps more for Mariela. So do you have any tips, Mariela, for UK-based reps that they can learn from the campaigns that some of the campaigns you were talking about before, as some of the union wins? Maybe your top 3 tips would be good.
Hi, and just
we seem to be getting this echo problem again. Okay, Mariela, have you got some headphones that you can plug in? Okay. Right, well, Mariela's getting those. I'll put a question to Zenei. We're all about improvising here and going with the flow. So we've had a question posted about, you mentioned, Zenei, that you have a lot of maybe anti-union campaigning from the employers. So how do you persuade a potential member who you might be speaking to who's scared of joining a union? What do you say to them to help persuade them otherwise?
So first of all, we need to make sure that we are in a safe environment when we talk to that nurse, because they don't want to be seen talking to us, right? So we ask them about what is the issue that they want to see improve in their hospital. So they tell us what's going on, and then we assure them that if you join a union, it's not just you speaking out and up about an issue, but you have one solid voice. You are standing in solidarity with all of your union sisters and brothers. So you are not alone. You're not there out on the limb by yourself, but you are with a big group. So they are, they get hold of that, and they're happy that that would be the case, and then they are eventually persuaded to sign the card and eventually join the union. So we have to make sure that they are assured that they're not alone and they have the backing of the big group.
Fantastic, thank you. And while Mariela's just getting set up there, I'll ask you another question that's specific to the US. So in the US, do trade union representatives have rights under the law? In the UK, we do have some, but if you don't have them, how is the trade union movement as a whole approaching this?
So when you mean trade union, you mean the unions itself, right? Our organizations.
Well, when we talk about trade union reps, we mean people like yourself who work perhaps in a hospital or in a shop, who are the union's representations in the workplace, who can go and speak to people about issues and represent them.
Right. Okay. So we do have that right. So myself as a nurse representative, I have the ability to talk to our members. And of course, this will be all done during off hours, not during my shift. So when I'm off shift, I have the ability to walk around the hospital and talk to our members, and then set up meetings if there is a grievance that needs to be resolved. So I can do that. But again, not during my shift when I'm taking care of patients. So it would have to be outside of my shift. But we do have that right.
That's really interesting, Zenei, and I'm sure any colleagues or any viewers, they've probably got comments about that, because it works slightly differently here in the UK, but perhaps we can talk about that with you another time. Okay, I'll just jump back to Mariela and see how we're doing with the sound. Okay, so my question was, what would be your top 3 tips that UK-based union reps can learn from some of the union wins that you told us about before?
I'm sorry about the headphones. I can't get it to work. Can you hear me?
All good. All good. Go for it.
Yeah. So yeah, in terms of learning from others, I think it, in some ways, there's obviously different situations in each country in terms of the law and how union rights are respected or not respected. So there's obviously different contexts, but I do think learning from through sector federations, like definitely linking up with your
all good, go for it.
And linking up with your sister unions.
Mariela, have you got the webinar open in another window?
No, just in Google Chrome.
Okay, it's really unsettled. It seems to be working again now. Right, let's try again.
Okay,
please carry on.
Sorry, everyone. I was saying, obviously it depends, because there's different situations. So it's about learning from what you can learn from, and obviously disregarding the things that can't be changed. But I think definitely linking up through sector federations is important. And as I said, I think the global union federations have done a really good job of collating a lot of information of what's happening in different sectors and comparing them. We definitely at the beginning were weekly providing kind of updates to people in the movement here of what was happening in terms of economic packages, different things that were being agreed, that were really useful for us in terms of thinking through what we were pressuring and campaigning for. And I also think in terms of solidarity, also, there's a lot of workers that are facing such dire situations, and situations where trade unionists have always been repressed or have been increasingly repressed. So I think some of the themes that we brought out at the Organise conference last week, where we had, a session on the growth of the far right, a session on organising in some of the worst countries in the world, for example, Turkey or Colombia or Palestine, or workers, also women workers, and particular issues faced by, migrant workers. So I think it's also showing solidarity with some of those workers, and supporting campaigns that are being set up to support workers around the world.
Thanks, Mariela. I've got another few questions for Zenei that I'm going to put to her now. So we've had a question asked about in the US, are there any services in place for nurses to support their health and psychological well-being during this crisis?
Yes, there is through most of our employers, and that's available. And also, we have had a lot of webinars about how to deal with issues. And we do have a crisis hotline that's available in each county, in each area if they want to. And that's through the local governments. But again, it's not enough, and I don't think it's adequate. But we could do better on that front. So there is something available, but it will not be enough. We need more.
Absolutely. I think we can probably say that for almost everywhere. While it's good there is some provision, we do need more. Okay, another question here. How do you protect nurses from being sacked if they join the union? And have you used social media at all to show the unsafe working conditions that you mentioned earlier, for example, when there's no PPE?
Yes. So for your first question, if nurses are protected when they join the union, yes, they are protected because they have the right to join a union if they want to. Second, on the issue of lack of PPE, we have used the social media as a means to expose the lack of PPE. And also, we have had press conferences when an employer does not provide us with the optimum PPE. And also, we have had actions in front of the hospitals where there is a lack of PPE so that the public and the community know that these are your nurses complaining about, the need for PPE, so that if we, the nurses, are not safe, then we know that you, the patients, will not be safe either. So we make sure that that's well promoted when we do actions in front of the hospitals.
Sure, and I think that's a really great example of an action that can be effective. I know there was something done similar in the UK at hospitals and actually in front of government buildings. It wasn't big, but it was very powerful. Okay, another question there's lots of questions coming in for you now, Zenei. I'm just trying to find another one that was really helpful.
Can I address one comment that was made by Helen? She says that I should be paid for the time that I spend. When I schedule a meeting with a nurse and the employer, I am on paid time. But if I make my rounds and do walkthroughs to check on the nurses, then it's on my own time. But if it's the employer who's requesting a meeting, then we are on paid time.
Thank you for clarifying that. Question here also about some of the actions you mentioned. So nurses in the UK fear going out on strike. So how did you mobilise nurses to take strike action? And how did you get the public on board with this action too?
So before we go out on a strike, or if we have plans to strike, we educate our members about the ongoing issues. So we give them all of we lay out the plan and we lay out the cards. So we tell them this is where we are and this is where we want to go. So how do we go from here to there? So we give them all the information, we give them the education, and we give them choices. So we take a vote. Do you want to go out on strike or you don't? So a lot of times nurses are so fed up and they're willing to strike. So we go out on strike. And all of our issues are all around patient care. It's all about patient safety. So when we go out to the public knows that we are fighting for them much more than we are fighting for ourselves. Because if you think about it, if we have a fast turnaround, of nurses moving from one place to the next, then we are not invested in that particular community. And so the public knows that the longer the nurses stay in one hospital, the better it is, because then we develop that bond with the patients in that particular community. So the public knows that if we are out there, we are fighting for them, right? For their safety, much more than we are fighting for, again, the money or the economics. And so they know that nurses will always be the advocates, fighting for their safety.
That's a really great idea, I think. And yeah, I think, Zenei, you've had so many good ideas when you've been telling us about the campaigns and the work you've been doing in your hospital. There's so many good suggestions there that we can take on board and apply to lots of workplaces, not just healthcare. I think there are some really transferable ideas. Okay, time has absolutely sped by, and we've been broadcasting for 50 minutes now. But before we finish, I'm just going to put one question to you both. So to you first, Zenei, we do have some anecdotal evidence that in the UK, union membership is starting to go up in some sectors, not in all, but in some. Are you starting to notice that in the US at all?
Well, I hate to say this, but it's only our organization who are being successful in organizing our nurses. Unfortunately, in the other trades, other sectors, it's not as successful as well. And it's very difficult because we work hand in hand with them. We work side by side with them in the hospitals. And so whatever we can to help them, we would. But again, unfortunately, it's the nurses who are making strides into organizing. So.
Oof, I was on mute. Mariela, with any other countries that you mentioned earlier, or any others, have we got any early signs that union membership might be increasing at the moment?
We've only really had it through all we saw in Sweden that they'd grown in membership, but obviously it's not one of the worst hit countries, but that was the one country that stood out as an early place where union membership had grown. But definitely we think the profile of trade unions and the kind of role of trade unions publicly has grown in a lot of countries as they've taken this leading role in terms of trying to find solutions.
Thanks, Mariela. So yeah, I wish we could stay on longer to answer more questions, but perhaps we can put some of the specific questions that we haven't been able to answer to Mariela and to Zenei to perhaps provide a little written answer for us, and we will post it as a resource. Maybe we could look to do that over the next week or so. We don't have to do that today. So all that remains is for me to thank our panel. They've been absolutely fantastic, and I think we've learned loads about what we can do to continue union organising, continue to get the best deal for our members. Thank you to all of you for tuning in and for bearing with us with the glitchy technical side of things, but we got it sorted in the end. Whew, I was incredibly relieved. So yeah, thank you again, and have a good rest of the evening, and we'll see you again soon for another informative webinar. Thanks very much.